Greetings, my Be Health Empowered family. Thank you so much for joining another episode of Excuse Me, Doctor. My name, of course, is Dr. Melissa Clark. I am your host. You know, I love it when you call me Dr. Mel. And you know, we're here every week doing what we do here on Excuse Me, Doctor, making sure that you, my Be Health Empowered family, has all the information that you need, the trustworthy information that you need to make sure that you're making wise health decisions, not just for you, not just for your family, but even for your whole community. And thank you for tuning in. If you're on Facebook and it's your first time, or if you just haven't gotten around to it, please remember to hit like. And if you're tuning in on YouTube, please hit that red subscribe button. I super appreciate you for it. Thank you in advance. And of course, you know, we are here to make sure you get your questions answered. And so I would love also if you make sure you put your questions and your comments and your thoughts in the chat as we go through our weekly recap, as we go through the debunk that you tune in for every week, and of course, our topic for tonight's show and the wonderful guest. I know y'all are going to have questions, so make sure you start putting stuff in the chat as it comes to you, and we will get to it. And of course, in order to get to it, what do I need? I need my wonderful co-hosts, Miss Bria Good and Mr. Wayne Bruce, to join me on this wonderful week. How y'all doing?
Howdy,
Oh,
howdy.
wonderful. It's always howdy.
Dr. Mel was giving up some old hip hop phrases. I was like,
Like what? Like what?
Like, you sit back. I thought it was a hippity hop that a hip did a hop coming up, Dr. Mel.
And ain't
And you
nobody said
don't
all that.
stop. And you
And
don't
you don't
stop
stop. You know,
with the music that'll make your body rock.
oh,
Okay.
watch out.
Don't try me. Don't try me.
Don't
I'll
try
go
you.
there.
Don't try you. There you go. There you go. Got to get our BDO symbol in there. Shout out to everybody watching us on Black Doctor.
Hey,
Check it
y'all.
out.
Come on.
blackdoctor.org on Facebook and YouTube, and Dr. Melissa Clark on Facebook and YouTube.
That's
Right?
right.
Mhm.
That's right.
And shout out to everybody in Radio Land.
Oh,
That's
Right?
right. Hey,
yes.
y'all.
We happy to
Everybody.
have everybody here.
So look,
Absolutely.
this show I'm excited about because it's what? It's about the holiday spirit. How
That's
did
Mhm.
right.
that happen?
Whoa. I am so impressed with
Oh,
that.
so cute.
Okay. So, for y'all not looking at the screen right now, we have Christmas lights, holiday
Yeah.
lights lighting up the screen. And, you
Yeah.
know, it's just a reminder that, look, the days are getting shorter. The sun is
Mhm.
shining less. It's colder. And we are all more stressed because of the holidays, but we don't have to be, right?
No.
Even though we're spending more money, even though we might be missing loved ones who are either not here with us anymore, maybe because of a breakup, whatever the reason, we can still have joy during this holiday season. It doesn't have to stress us out. So, we're going to talk tonight about how we can not just survive, but thrive during this holiday time. So, I am like ready for it. We have an incredible guest. It's going to be a great
Yes.
show.
Yeah.
It's going to be an amazing show.
I'm excited. So we got to go to the weekly recap, right?
That's
Yep.
right.
Everything that's in health and wellness in the past week.
Alrighty. So, it's not right if we don't start with COVID, of course, because the holidays are coming. We're going to be indoors. So, what's the COVID update? I know there's some new stuff about long COVID too, right?
Right. Well, nobody's paying attention to COVID. I mean, let's be real.
Not a
But
You're
bit.
right. You're not wrong.
It's a shame.
But while we're turning our backs, it snuck up on us after Thanksgiving because people
Mhm.
getting together, getting together for Christmas parties or traveling more. So, of course, we have an uptick in cases, uptick in hospitalizations. And the hospitalizations aren't just happening because of COVID. We actually have a 60% increase since last year in RSV hospitalizations. Of course,
Yeah.
that's the very people over 65 and the little ones under 2 that is hitting the most. And we have the highest number of flu hospitalizations in a decade. So
Ooh.
hospitals are getting slammed, y'all. Whatever you can do to avoid going to a hospital, with one of these three triple demic things, please do it. Please get vaccinated with flu and with against the flu and against COVID. Please wear your mask indoors. We know that more and more
Mhm.
states are now and counties and cities are calling for us to go back to wearing masks indoors. I know it's not on everybody's mind, but you might want to do it so that you can have a happy holiday with your family and you're not laid up somewhere. So, just a suggestion.
Please do that because if it's not COVID, it's the flu. If it's not flu, it's RSV. If it's not RSV,
Right.
it's something else. We're just waiting for the
Yep.
next thing. But what's the thing with stress and long COVID?
Yeah, so stress seems to be like a theme tonight that we're going to get into. And this is
Mm.
the first big point about stress. So, 24 million people right now have long COVID. 80% of them are saying
Ooh.
that it's affecting their life and making it more difficult to function. And, if you had COVID, no matter how severe it is, you're at risk for getting long COVID. About 1 in 7 people go on to continue to have these COVID symptoms long term. And so it turns out that the long COVID symptoms, that, the ones that happen for more than 4 weeks, the depression, the brain fog, the trouble sleeping, the chest pain, shortness of breath, that if you have a stressful life event around the time that you have COVID, um, that actually increases the likelihood of your getting long COVID. So they're really starting
Mm.
to look at, for the treatment of long COVID, incorporating mental health treatment, stress management techniques as well, because when you're stressed, it depresses your immune system, which makes it more difficult to clear the virus out of your system and make it more possible that you go on to have long COVID. So those techniques are important to help your immune system be strong enough to do what it's supposed to do, eliminate stuff from your body that's not wanted, like COVID.
Mm. Look, stress is connected to everything.
Yeah,
Everything.
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 preach.
Like,
Come
Yes,
on, man.
exactly.
and have they figured out what happens if you get diagnosed with COVID more than once?
Well, basically, there was this study in veterans, and it showed that for every infection of COVID that you get, it increases your chances of having complications, ending up in the
Wow.
hospital, dying, getting long COVID, and getting organ damage. So, again, you want to
Oh wow.
minimize the number of times that you have COVID, um, and getting vaccinated will help that. And if you do get sick and you're in a high risk group, get Paxlovid prescribed, that 5-day medication that you can take to cut down on the risks of complications from COVID.
Wow.
Y'all heard it every
There
week.
you have it.
All right. So, what else we got in the recap?
So look, Dr. Mel, I looked at this common joint pain treatment may worsen your joints, and it was relevant because in the north, in the northeast and parts of the northwest, cold weather usually, the old folks, which I'm growing into, usually say, "My knee, I know it's gonna be, I know it's gonna be cold because my knees are hurt."
It's about to
Right. Or
rain.
rain.
My
Right. Or about
author,
to rain.
right, or it's about to rain because my author is messing up when they were talking about arthritis.
This is true.
So tell us what's going on with joint pain and joint pain treatments.
Yeah. So, osteoarthritis, which is what you're talking about, is that wear and tear kind of arthritis that people get.
Hmm.
Um, and it causes pain and stiffness.
Hmm.
And more than 32 million people suffer from it. Mainly comes up in your hands, your knees, and your hips. There's
Mm.
no cure, but a lot of people know you get that steroid shot in your joints, and that's supposed to help. Well, two small studies show that on average, knee arthritis gets worse quicker when you get steroid shots. So even though it gives you some temporary relief, it actually leads to some linkage with the cartilage breaking down faster. Maybe it's because you feel better and so you do more stuff. Or maybe it's because the medication itself is accelerating the cartilage
Mm.
damage. They don't really know. But based on this, if you have arthritis and you're going to a specialist, talk to them about what the different alternatives are, because there are other options other than steroid injections. That should be the very last resort.
Right. Thanks so
Yeah.
much, because my author feel like messing.
My arthritis. Glad I don't have to worry about that for a little while.
On that note,
Okay, so being born while Black. So the Black birthing space is my jam. So let's talk about
yes.
being born while Black. What is that like? Is it like driving while Black, living while Black, everything Black? What's going on?
Yeah, pretty much. So we know about the fact that infant mortality in the United States is twice as high for Black babies as it is for white babies. Well, it turns out it's not just limited to the United States. There was a
Mm,
study in a prestigious journal called The Lancet of over 2 million pregnancies worldwide across 20 countries. And it showed that if you're a Black baby, you have significantly worse survival and health consequences if you come into the world in a high or upper middle income country. So that includes the US, the UK, and Canada. Um,
mm,
and it showed that Black babies were twice more likely to die in the first 28 days after being born or being born stillborn compared to white babies in the same countries. And they have more often preterm birth, small for gestational age, which also lead to health consequences down the line. So,
mm,
important to know, not necessarily something that, we can do about it as an audience, I'm sure, but I think it's just important to highlight that this is something that's happening in multiple countries. And, we know that systemic racism plays a part in it. We know that poverty plays a part in it. We know that bias in the healthcare system plays a part in it, and that there are active solutions being sought to it. One of which
mhm.
is doulas, right?
Yes, get y'all doula. Slight plug. Let's get in
I don't know
it.
if y'all knew that Bria is studying to be a doula. So very
Yes,
important, very
ma'am.
important.
Are
Call me,
you
beat me.
studying, Bria, or are you a doula?
It depends on how you look at it. Certified wise, studying, but I've been
Okay.
practicing doula and childbirth education for the past year. So if you need any
Okay.
questions, call me, but don't blow up my DMs, y'all. Just hold on. I know I'm a celebrity. Just give me a second.
You said you're a sobriety.
A sobriety.
Celebrity.
That's what I heard. I heard sobriety.
Sobriety. Look, we're all sobrities. So, 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 Dr. Mel, I recently had a checkup, my annual physical, and we went
Mhm.
in the blood pressure machine. Blood pressure cuff wasn't big, and so it had a crazy reading. They were like,
Okay.
"Oh, you have high blood pressure," and I asked them to change the cuff, and the blood pressure came back down to my normal reading.
Okay.
And yeah, great. So I was wondering, just with the readings, I mean, people I don't think know what the numbers mean. Like, what does 120 over 80 or 120 over 74 actually mean for an
Right. No,
adult?
that's excellent question, and also excellent observation that if you have a big arm and they use a small cuff, it's going to artificially elevate your blood pressure. So make sure they're using the right size cuff. It shouldn't be tight on you before it even starts to blow up, right?
Yeah, they had
So
to hold it on. It was
yeah,
wild.
that ain't cool. So what blood pressure is it's the force of the blood pushing against the walls of your arteries when your heart squeezes, the beat of your heart, it's squeezing and pushing blood out. And so that's the top number, is when it's pushing blood out. When it's relaxing and accepting blood back in before the next squeeze, that's the bottom number. So that's the pressure that's in your system during each of those events. Um, Now, the higher the number, 120 over 80 is a normal blood pressure. Anything from 100 over 60 to 120 over 80 is normal. But the higher the number above 120 over 80, that means that that's an abnormal pressure that is being exerted on your arteries. So you're going to get wear and tear over time. For every 20 milligrams of mercury, so that's the unit, or for that top number, and every 10 milligrams of mercury for the bottom number, it increases your risk. It doubles actually your risk of heart attack and stroke if you're over 40. So, these increases in blood pressure happen slowly over time. You'd never even notice it. So that's why high blood pressure is called the silent killer, because you
Mhm.
might have this heightened blood pressure and not even really know about it.
Mhm.
Thank you
Wow,
for
that's
breaking
cool.
that down.
So, what criteria did doctors have for even starting somebody on medicine?
Great question. So you first have to have two or more readings that are high on two separate visits to the doctor, because they want to just make sure that this is an actual thing and not what they call white coat hypertension, which means you're nervous and anxious, and so it makes your blood pressure go up when you go to the doctor. So at least two readings. And then the criteria to start on medicine is if you're over 130, up between 130 and 139 on the top number, or 80 to 89 on the bottom number, your doctor will say you need to change your lifestyle, and we'll go into what that means. They may or may not start you on medicine. But if you're over 140 over 90, if you're above that, either on the bottom or the top number, they will definitely start you on medicine. So those lifestyle changes, y'all know what some of them are, right?
Yeah,
We talk
not
about them
showing
every
up
week.
at the doctor's office with a half smoke in your mouth. not,
Eating right, getting your
not
exercise.
not showing up with a pork chop and
Yeah.
riding a scooter. Just
Yeah, that's yeah. Well, definitely quit the half smoke and quit smoking.
right.
Yeah.
And then I think I heard Bria say exercise.
Mhm.
Losing 10% of your body weight if you're obese, that's a place to start. And then getting checked for sleep apnea. A lot of people don't realize that,
Mhm.
but if you're a snorer, you should get, or if you have a new diagnosis of high blood pressure or a new diagnosis of diabetes, you should get checked for sleep apnea, because that will worsen. That actually might be the reason why you have high blood pressure.
Wow.
You want to limit your salt intake, 1.5 grams a day, no more than that. Limit your alcohol intake. Alcohol actually increases high blood pressure. And then, of course, what's the theme for the night? Managing the
Mental health.
Managing the
stressors
stress.
in your life. Right.
Mhm.
So that's it.
That's
Well,
great.
great recap, y'all.
All
Yo, we
right.
know what time it is.
What exactly what time is it?
It's
The
time.
weekly debunk, stopping misinformation in its tracks.
So
Alrighty.
go ahead, Bree.
Oh, all right. Perfect. So the Twitter finger family keeps getting bigger somehow, some way. And Tasha, texted me saying, my doctor keeps talking to me about some daggone flu shot. But I know it gives you the flu, so I'm not worrying about it. Hmm. That don't
Don't
sound
know
about
about
right.
that. Don't know about that. Excuse me, Dr. Mill. Is that true?
Of course it's not. Every time, every time this time of year comes around, there's, misinformation that gets circulated about the flu vaccine, that it gives you the flu. So this is the deal. Flu vaccines are either made with a weakened live virus or a dead virus, right? So these things cannot give you the flu. What it's doing is it's presenting the flu virus to your body in a state in which it can't cause disease, so that your immune system can then react to it and make antibodies. So that when you do encounter the flu for real, you then know your body then has the antibodies all ready to go and lined up to knock it out.
Mhm.
Now, your immune system, when it's revving up to make antibodies, can sometimes give you a little bit of fever, a little bit of achiness. The same thing happens with the COVID virus, same principle, little headache. Um, and so some people might misinterpret this as, oh, it gave me the flu. But the difference between this and the flu is it's much milder and it goes away in a couple days, versus the flu lasts for at least 5 days. So thus far, sorry, to date this year, we've had at least 13 million cases of the flu, 120,000 hospitalizations, 7,300 deaths so far. And it's only December. Flu season
Mhm.
lasts till April. So it is not too late to get your
Wow.
flu vaccine. Check your vitamin D level, make sure it's up to snuff. See if you need to be on supplements. Get your fresh fruits and vegetables, eat the rainbow, take your vitamin C supplements. And of course, listen to the rest of the show to find out how to cope with the stress in your life, especially around the holidays.
Mhm. You heard that, Tasha? I know she's watching. So
Okay.
Twitter finger.
Hey, shout out Tasha.
All right, Dr.
Well,
Mel.
thank you all. Bria, thank you, Wayne. And we will see you in a little bit. But of course, right now, we are going to transition to talking about the fact that it is the holidays. The year is winding down. Earth is going into hibernation at the solstice in a few days. And that's really what our bodies want us to do. But, you know, the opposite is happening. Things are speeding up. Things are getting more stressful. There's more worries. And so we want to focus this episode on how we can go about having a more peaceful, a more loving holiday. I talk about the 5 self-health actions, one of which is managing stressors in our life. And I list it last because it's really, I think, the most important because stress has such profound effects on our body. So I have an incredible guest joining us tonight who's going to help us with strategies for not just surviving the holidays, but actually thriving during the holidays. Her name is Dr. Sherri Simpson Broadwater, also known as Dr. Sherri. She is double board certified, and she is a teen, adult, and child psychiatrist who specializes in helping women and their families transform frustration and chaos into health, wealth, joy, and safety. So, thank you so much, Dr. Sherri, for joining us. I'm delighted you're here.
And thank you for having me. I'm excited too.
All right. Well, good. Well, just tell us a little bit about what you do, about your practice. I know that, you take a body, mind, spirit approach to your work. What does that mean?
So what does that mean? So let me tell you a bit about my practice first. So I'm proud to say that my husband and I own what we believe is the only African-American brick and mortar psychiatric and coaching practice within 285. So if you know anything about Atlanta, it is the main freeway. And so we take care of lots and lots of people, not all Black, but majority Black. And so we pride ourselves on being able to look at the person, our patients and our clients holistically, comprehensively, and that means mind, body, and spirit. So the mind, the consciousness parts of us, the body, which is the structural part of us, the anatomy, the organs, the tissues, and also that spirit. And so which is the non-physical part of us, which is where hope and faith and grace and that higher power belongs in us. And so that is how we address all patients. And so it is important that whoever you're seeing in terms of if you're a patient, that you align with the person that you're seeing. And so if you believe in God or Christianity or higher power, however you think of it, that you are asking your physician, provider, prescriber, how he or she or they think about that, because that part has to be addressed as it relates to health overall.
Right. And it has to align with what you believe in your everyday life. That makes perfect sense. So bringing that around to the holiday season where we are now, what are some of the challenges that you're seeing people having to deal with because of this time of year?
Okay. So, and my spirit has been saying sort of over the last week or so that too many of us have been or are unwilling to make shifts and changes as it relates to the holiday season. So that many of us are in a I don't want to say a rut, but it's monotonous. It's traditional. It's unchanging. It doesn't feel fulfilling. It feels like a chore. It feels like tasks. It feels like things that we just sort of have to do. And one part of being mentally healthy is being realistic and being flexible and being able to make changes. So that is one of the, so that's the main thing, that people are coming to me saying that I don't want to go home this Christmas. And I'm saying, well, do you have to go home? Are you willing to think about it differently? Are you willing to have those conversations with parents and siblings or even children about if I do come, how can it be? How can we create something different? Or family, can you be okay that this is the first Christmas or the whatever Christmas or holiday season that I won't be there? Too many of us are also unwilling to have those difficult conversations. Too many of us are not not in the habit of having those hard and difficult and complicated conversations. So because this issue with Christmas is just another example of the issue in the relationship, and so then it just festers, it just sort of piles over, and then the next holiday or the next issue, the same issue comes up. So those are the main two issues. And also the financial part of it is that, this expectation that's either, that's externally driven, internally created, whatever society, also driven, that we have to spend a certain amount of money in order for the holidays to feel a certain way.
So dealing with everybody's expectations
Right.
around how much money you're going to spend, right?
Absolutely.
But I want to go back to that first part, having difficult conversations, because not all of us are skilled in doing that. How do you have a difficult conversation with a family member or a loved one about expectations around the holiday?
Well, I think first we have to reflect on your wheelhouse in being able to have hard conversations. So let's be honest. If you struggle with that, then you may want to seek some help to help you do that. Okay. If you are able to have complex conversations, I would, if we haven't had it, I probably would write it out, write the details out of what you want to say. I would suggest that you practice it. I mean, two pathways. Are you a feeler? Are you a thinker? Are you a feeler or you're a thinker? If you are a thinker, oftentimes that means that people they're too direct, they're too blunt, it's too straightforward. So they've got to practice talking about their feelings. I feel overwhelmed. I feel sad. I feel disappointed. I would like to feel better if, and what if could look like. Okay. So, but if you're a feeler, that means that I feel so sad. I feel so upset. I feel so lonely. And it's so over because the content is so packed with feelings. What is actually going on in terms of the details and what you actually need don't get across to the other person. So practice with that, and also role play. But this also means that you have emotionally healthy people in your life to be able to have these conversations with, to practice with.
Right.
And before you go ahead, especially if you know that this is going to be a hot topic and it's going to really be upsetting to the other person.
Sure. No, those are excellent strategies. Because, a lot of people are like, well, I know how to have hard conversations, but they're really talking about arguing. And the idea is not to turn it into an argument or go into it feeling confrontational, but really more from a problem solving and a communication of, being as one, communicating, right? So, what are some signs, that, like we talked about in the beginning, so many things that overwhelm, sometimes people are dealing with the loss of a loved one that happened around a holiday, or this first holiday not being with a loved one, or perhaps because they died, or perhaps a breakup, or perhaps illness. What are some of the signs that you individually might not be handling the stressors around the holiday well?
Well, a few of the signs are that if we're chronically not sleeping, And what does that look like? Most adults need between 6 and 8 hours of sleep. So if we're chronically sleeping less than that or even more than that, and we really don't feel rested, and we can't, and our typical means of being able to shake it don't help. Another one is that we're also eating differently, that we find ourselves, we're sort of snacking and sort of grazing, or our commitment to healthy eating is less. And again, we're not able to make changes that we typically would. So, and then another one is anxiety, worry. What does anxiety look? Anxiety looks different anxiety looks different to different people. Okay, it just does. And so for some people, it is rumination. So I'm ruminating. I'm going, what if, what did I do? What did I do? What's going to happen? So we're going back and forth, feeling trapped, feeling stuck. If we're more short, more irritable, if we have thoughts of death and suicide and overwhelm, and first of all, if that's new to us, then we definitely need to seek help. If those things are chronic and we find that they are more intense and we're thinking about them more frequently, those are indications that we need some additional support. And another thing is also how we're managing alcohol, drug use, food, sex, shopping,
all those things that give you
yes, all
quick
things,
fix, quick high, but aren't really lasting.
Right.
So when you do see those things, what should you do?
The first thing I would do is, and I have a little bit of a cough, I apologize. The first thing I would do is ask for help. Reach out for help. And hopefully, because we are emotionally healthy people, and let me go over the definition about what it means to be mentally healthy, is that we are realistic, we are flexible, we have a variety of relationships that are fulfilling and nurturing, we have a variety of activities that are also fulfilling, we have a self-care regimen. That means that we have healthy body and wellness habits. We have a variety of coping skills. We have a variety of problem-solving skills and help-seeking skills. And also that we have a positive identity and that we can manage our thoughts and feelings and beliefs and responses appropriately. Okay, so that's just what it means. So the first thing I would do is reach out to my emotionally healthy support and let them know how I am feeling. Let them know how you're feeling. Let them know what your triggers are. So my triggers are, let's say that if you haven't heard from me, and this is something that's for your loved one to be thinking of it as it relates to you. If you haven't heard from me in 3 days, and you know that's atypical, I need you to check in on me.
Right.
This is an overwhelming time for me. I need you to initiate contact, some kind of face-to-face contact with me at least once a week. Are you willing to do that? Are you willing? This is to the friend. Are you willing to hold me accountable to being healthy this week and during the next few weeks? That means talking about healthy sleeping, talking about hydration and appetite, talking about how I'm coping and dealing with stress and problem solving. Am I getting out? Have I cleaned up my home? Have I bathed? Those are the kinds of really in-depth questions that really need to be asked. Another thing that we can do if people don't have support is talk to your primary care physician or provider. It is critical that we do that. There are also a variety of online sites where people can seek help. There's Headspace, there's Talkspace, but this is not the time to problem solve alone, because one of my favorite phrases that I copyrighted, I think myself, I created this, which is, it is very difficult to work on your own mind in your mind by yourself.
Mm,
We can
right.
we can assume that we can turn it around, but
Right.
we're using our own counsel, so it is unlikely that we will if we haven't been able to up to this point.
Right. So it's basically you can't use the same tools that got you to the place where you are to get you out of it.
Exactly.
Sometimes you need that mirror, sometimes you need to reach out, get the help that you need, and there's also the new 988 number, right?
Yes,
Um,
yes,
the new
yes.
national 988 number that you can call. It's like a crisis hotline, for anything having to do with mental health or substance abuse, so there's also that as well. Um, so, family stress obviously is one of the things that is really high. Having to get together, we kind of talked about that in the middle, in the beginning, having to get together with family at at the holidays that you might love, but you not might not like. So, what are some of the tools that people can use as they get together with family to cope in those kinds of maybe some dysfunctional environments?
Well, one of the things that again we can do is we can decide not to go. You can decide
Right?
not to go. You can decide that I want to do something different. You may, but you will have to reconcile what that will mean to you and to others. But you can
Hmm.
decide not to go. Okay. You can also decide how long you stay.
Hmm.
You can also be problem solve and use your voice and say, "Hey, what else can I am feeling this with our Christmas tradition to the host
Mhm.
or to others. What are your thoughts? What are your feelings? Has anyone else felt like this? Are is there space to create something different um, for not just me, but for our family? Is this
Mhm.
a time to create some different, not time, but can we create some different traditions and a different experience? But
Mhm.
it does require that we use our voice to make those things happen. Um, Another thing that we can do is that we can limit our time. We can also have a wingman, like just like how you have at the club. Sometimes you have a wingman, you wing girl. You have a wing family member.
Right. When I pull on my ear, that means come over and rescue me.
Right,
Right.
right, right, right. Or every 15 minutes, come over here and look at me. If you see if you see I'm alone and unengaged, would you come in and check on me?
Right,
So
right.
so we can do those things. I would if family um, gatherings are stressful, it is very important that we monitor our alcohol use before, after, I mean, during and after, so that
Mhm.
we're not self-medicating. And
Mhm.
also knowing what are our triggers when we get there. So especially for, I know we were talking about maternal health. So some of my um, moms, my want to be moms, can feel
Mhm.
very stressed going home when those questions come up about, oh, when are you gonna get married? And oh, I can have
Right.
a baby.
Yeah.
And even dads who are
When is the wedding date? Right.
when it's the
Yeah.
wedding, and then if there's the baby hasn't come during the time frame that we thought, then there are infertility issues. Also
Mhm.
prep people about what to ask, what we're open to, what we are not open to, but also be prepared to answer in a way that feels good to us.
Right. No, that makes total sense. And you mentioned like a list of those things that make us emotionally healthy and defined what mentally healthy looked like. And I thought that was wonderful. The flip side of it is when we're not handling the stressors in our life well, that these things can have actual physical effects on our body. And I differentiate between stressors and stress because they're different, right? So maybe you could break down for us what's the difference between a stressor and feeling stressed?
Okay, so the stressor is the actual life event that is happening to us. So that is typically, I'm sorry, we're trying to get my charger together, so we apologize. The stressors are, death, divorce, and even marriage. Marriage is a stress. Marriage is a wedding is a stressor because it does evoke positive and negative feelings, nervousness, anxiety, worry, overwhelm, financial obligations, illness, job stress. So again, the stresses are the actual life examples, and the stress are the physical and mental and psychological ways that we are affected by the stressors.
Mm-hmm.
And so it is important to know what are stressors to me, and how do I manage my stress? Like when I am stressed, how does that show up? For me personally, it shows up in I graze. I gave that example earlier. I graze. I can be grazing all day. What else does it look like in terms of just behaviors?
I know for me, I get irritable.
Irritable. Some folks, it could be psychosomatic, so they could be headaches, stomach aches, pain. Sometimes people can feel like they're, chest pressure. Some people can feel dizzy. So there are a variety of ways that stress can show up in our lives.
Mm-hmm. So it's really important, I think, one of the things I heard you say is to know yourself and know, number one, that not every stressor stresses people out. I like to give the example of people riding on a roller coaster. Some people are having a great time, some people are terrified, some people, might be on their cell phone. They're just totally not affected by it. So different stressors affect people different ways. So you have to know what stressors affect you, what the signs are that you're being affected, so that you can do those emotionally healthy things, which I thought was a great list of things that you can do when you recognize that happening in yourself. So, you know what? I have a ton more questions for you, but it is time to bring Bria and Wayne back to see what's going on in the chat, to see if we have any questions from folks. Bria and Wayne, are you there? Hey, okay,
Yeah.
there
There
you
we
go.
go.
There you go.
Yeah.
And what are you seeing in our chat from our Be Health Empowered family?
Yeah. Do you want me to go first, or
Yes.
you want to go first?
Go, Bria.
Okay. So the first question is, how do we handle friends and family who don't want to talk about mental health?
Good
How
question.
do we handle friends and family?
Who don't
So
want to talk about mental health?
Who don't want to.
who don't want to? That's a tough one, because we can't force people to talk about what they don't want to talk about. We do get to set parameters, limits, boundaries around what we say, how we say it, how to engage, how frequently engage, and how we will be engaged by them. You get to decide that, because if people are not ready, unwilling, don't have capacity to be well, then that will impact you. And you get to decide if that's the energy that you want in your space. And how I think about it, you have the closest space, that's that closest support of friendship and family, that's healthy. And then you have the second tier, and then you have the third tier. And just because people are family biologically, that doesn't mean that they deserve entry and deserve to be maintained in that closest space to us, because they don't. And that is
That's
very
good.
difficult. I have a lot of quite a few patients who some have been able to make the shift to, oh, I'm going to Tanya's house, or I'm going to Natalie's house for the holidays for my friends and coworkers, and I'm choosing to be enveloped by their families and be loved. I do have other patients who find it very difficult. They cannot shift to, this is my family. I don't feel loved. I don't feel supported. I'm supposed to feel like that, and cannot accept how love is showing up differently for them.
Hmm. So that speaks to that flexibility that you mentioned at the beginning. It reminds me of a phrase, the last time the dinosaurs met, they voted not to change. Life is just about change and being about flexibility, right?
It sure is.
Correct and correct. And also, and let me say back to that one, the person who made that as a question, that if it's multiple people who are unwilling to change, then that probably also deserves some deeper exploration on the person's part. So I have a variety of family members who have been unwilling to change. And as an adult person, it is highly likely that I have recreated that in my friendship space,
Mm.
That's a good
because
point.
this is just based on just attachment, sort of that stuff that happens when we're kids. It happens. We're here, parents are here, we internalize it. At some point, we recreate it.
Hmm.
So there may be some additional work that's needed to shore that friendship issue up.
And I think probably to have insight to that, you probably need to talk to a professional at some
Absolutely.
level to help you get insight into that.
Absolutely.
What else we have out there? I think you
Okay.
might be on mute. Your lips are moving, Wayne, but we
I
are not
want to get
hearing
this
you.
question in. My lips always move.
Mhm.
I've been told that. So I want to get this question in. How did we deal with not wanting to celebrate the holidays because our loved ones are no longer here? Do you hear that a lot? In your,
I do. Well, people, people. Let me just say, we as adult people, you get to decide to do what you want to do, right? If adult, if the people in your life are not here, and the Christmas and Thanksgiving or whatever day was most special because you shared it with them, and you choose not to do that, that is absolutely okay.
if you so I have friends who are dealing with that now,
Uh-huh.
and I asked that question on their behalf because the wife wants to do Christmas things and the husband does not want to do Christmas things. So it I guess they'll work it out, but when you're in a relationship, how does that work?
Well, excuse me. Christmas things. Does that mean nothing for 25 days?
Visiting family, going through presents, they don't want to do any of it.
That's a tough one. And in it, well, not in exchange, but is it that they would choose to withdraw, shut down, and sulk?
Yes, yes.
Okay, but then that's where the issue is. So the conversation is, I would ask, babe, are you depressed? I love you. I think you're depressed. Because one of the clinical signs of major depression, and major depression is five symptoms that only have to occur over 2 weeks, which is sadness or disinterest in those things that typically have provided me joy.
Mm.
So that's where um, you may not ask it. I mean, it depends on the nature of you all's relationship, but I would, if we're talking to the wife, if she doesn't feel comfortable, and I would definitely implore her, asking, is he willing to go talk to his primary care physician about how he's doing? And that is the inability to receive joy, create joy, likely depression, worry, overwhelm, helplessness, worthlessness, probably changes in sleep, changes in appetite, changes in eating, energy, and concentration. You only need 5 symptoms, more days than not, for 2 weeks in order to have a diagnosis of a major depressive disorder.
Wow.
And there's, well, talking to your primary care physician about it, but also, you mentioned tapping into that network, because some people don't feel comfortable talking to a physician about it. Although that is the first choice, but some people might talk to their minister first,
Absolutely.
or
Absolutely.
other options. And then there's always the benefits, obviously, of going to a physician is, other than talking about it, there's also medication that can be used to treat depression, and there should be no stigma around that, because it's like any other disease, diabetes, heart problems, whatever, that needs treatment.
Yeah. And remember, let's go over this again. Well, not again, let me make sure I say this too. Now, first line treatment for a clinical and most clinical anxiety disorders and clinical depressive disorders is not medication. All right. It is psychotherapy, it is talk therapy, it's talking it out and learning skills so that I feel better. And
Right.
after that point, but it's also based on the severity. If it's not severe, because it can take up to 1 year for a clinical depressive disorder, which is again 5 symptoms for 2 weeks. It can take 1 year to resolve itself.
Mm-hmm.
So, and I said primary care physician because so many of us, even though I'm a black, you said Bree, we're in Atlanta, and it's still a lot of African Americans that still would not come to see me. They may go see Dr. MEL, they may go see Dr. Lauren, but in terms of coming to see me, typically I'm the last hurrah. So that was
You meaning you as a psychiatrist. They'll see
absolutely
other doctors before they see you, right?
absolutely,
Yes.
yeah,
Yeah,
yes, yes.
let's
Right.
call it out. Let's name it for what it is.
Right.
And especially
Right.
men are more likely to see their primary care physicians
Right.
first. And I think that the black men specifically, well, I shouldn't say black men because I don't know any data, but I try to get my black men to go see black male physicians, because I think that really helps to just sort of traverse just a lot of issues, and can get you all help sooner than going to a woman physician. For some, not all, but for some.
Right. Absolutely. And I thank you for bringing that point up, that psychotherapy, that talk therapy is the first line. I brought up medications because sometimes they are prescribed and people are resistant because they
Right.
feel that makes them, quote unquote, crazy. And
Yes.
so the stigma attached to that whole process of treatment, I think sometimes, makes people not want to address it. So helping to sort of destigmatize it, I think, is really, really important.
Yeah.
What else are you seeing out there in the chat?
Well, that actually, you answered the next question, which was, could you talk a little bit about mental health in the Black community and how that shows up in the work that you do? But you talked a little bit about it. Not sure if you have anything else to add, but just to add on to that, and maybe you can speak to this, how can we go about breaking the stigma in the Black community when it comes to talking about mental health and seeking out mental health services?
Well, one thing we can do is talk about it. I mean, I know that I'm talking about when I'm sad and anxious and overwhelmed and can't sleep and just want to just smack everybody. I am talking to my folks. And then, but I'm also asking those questions of my friends, like, how are you doing? How are you sleeping? How are you eating? How's your mood? What is going on? I'm talking to my parents about it. So I think the more that we not internalize, but are aware that this is a part of us, and the more we are communicating to our spaces about those things over time, that stigma of that will decrease. But it does take us utilizing our voices. Like, for example, even here, like for years I've been treated for depression and anxiety for years. And in the medical community, there's been a stigma about even voicing that. So you have physicians who have all these different illnesses and ailments, but because of the fear of not being able to practice or losing your license, and all of this stuff. It's been such a secrecy attached to it. And at some point, especially with these young physicians, they just been blowing it out. They were like, I have depression, I have anxiety, I got this. And I was like, okay, me too. Okay, me too.
Right.
And
Right.
so, and the more, and I talked about my personal experience with psychotherapy. I did psychotherapy for 2 years. It was hands down one of the best decisions in my life. And I think, again, the more transparency that each of us have, even if we start within our own circles, then the more we can decrease stigma.
Right. Just the it's okay to not be okay. Because we as
Exactly.
humans, everybody goes through it at some point in their life and multiple times in their life. So
It's
Mhm.
expected we won't be okay.
right. Yeah.
And so then what do we do with that?
Yeah.
I think we have someone in the audience that backs up that. Richard Goodjoin says, I think it is important for providers to share their own mental health journey and
Yeah.
seeking care as a means to encourage patients to seek care.
Mhm.
Excellent point. Thank you, Dr. Goodjoin. Excellent point.
Yes. Thank you.
Yeah, I
Yeah.
was just talking to friends about that. Someone was saying, I don't want to see a psychiatrist who sees a psychiatrist. You should want to see a psychiatrist who sees a psychiatrist because it means they're getting help too. Everyone needs a little bit of help.
Right. Exactly. I mean,
so how could you have said that a little lighter?
yeah. Well, what's made me a better physician is going through the process of being a patient. So the same thing from a psychiatry standpoint, you have to be a better psychiatrist having gone through the process of being treated. So it makes perfect sense. I can't believe that we are out of time. I mean, we could just go on and on and on with this conversation. Thank you so much, Dr. Sherri, for dropping all that wisdom. And if you could just really quickly just repeat those things that define mental wellness. I just want to end on that note.
Okay, so I wanted to say, I just want to say this really quickly, making sure that we're validating what people are saying. I don't want to go, but thank you for sharing that with me. How can I support you in your journey to be well? Are you open to me talking about that on a regular basis so that I can, be a source of support and care for you?
Right.
Okay, so what is mental wellness? It is a practice. It is a practice of being realistic, being flexible, being able to manage our feelings, thoughts, beliefs, responses. It means that we have a variety of self-care tools, which include healthy body and wellness habits, coping tools, problem solving, and help seeking. It also means that we have a positive life identity and a positive collective identity. And so that is what it means to be mentally well.
Fantastic. Well, thank you. We will end on that note for setting the tone for the holiday season. Thank you so much, Dr. Sherri. Thank you, Bria. Thank you, Wayne, for the wonderful questions from the audience. Thank you, my Be Health Empowered family. And of course, before I go, I have to remind you that study that I've been talking about for a year is winding down. It will end in a month. That is that special Howard University research about how we have been coping during the COVID pandemic. So please, if you have any interest, it's only 2 surveys. You get compensated up to $100 for just completing those 2 surveys. If you have any interest, remember to reach out to Dana Harvey, and her information is Dana, D-A-N-A, Harvey, H-A-R-V-E-Y, research@gmail.com. Dana Harvey research@gmail.com. Well, thank you once again, my Be Health Empowered family, for a fantastic show. Thanks for tuning in. Thanks for the questions. Thanks for participating. Have a powerful holiday season in which you thrive, and have lots of joy and love. Thank you so much for joining us for this special edition. And remember, Be wise, be well, and be health empowered.
So I guess I should thank the Robinsons. They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry, Dave. Good luck with that.